So I am delighted to welcome Niels Bilenberg to the stage, who will be presenting on the complete spectrum of physical comorbidities with autism in a nationwide cohort. Thank you.
Yeah, thank you very much. Thank you for the presentation. I'm Niels Bilenberg. I'm a child and adolescent psychiatrist and a professor at the University of Southern Denmark. And I'm going to present something very different from the two topics we've just heard about. I'm speaking about the somatic or physical comorbidities of autism. I'm presenting some conflicts of interest. I've started to say I'm a non-autistic doctor and work as a child psychiatrist and been working as a child psychiatrist for more than 3 decades. This study is supported by the region of the Southern Denmark, and I have also received funding from other funding places for some of my other research. And as a clinician for many years, I have seen lots of children and youth referred for assessment for child and adolescent mental health services. Autistic individuals often have parallel clinical courses of contact with pediatric services or in other somatic clinical services. So my clinical experience is that co-occurring physical diseases are very common in autistic children. There are studies who have looked at this, but actually there's still sparse of evidence about this. There's a large or medium-large review with 10 studies which conclude that there's widespread co-occurring somatic diseases among autistic children, but the findings were rather inconsistent. And there's also 2 studies based on register data from United States, which also shows that ADHD is associated with medical conditions where significant more common in autistic children was like most of the somatic disorders. And another one showing that especially obesity and neurological disorders were common. And there's a lot of studies that has shown that epilepsy has continuously been reported as more prevalent in autistic persons. But no one has studied the risk of the entire range of physical diseases in autistic individuals. So this study design is that it's a study including more than 800,000 newborn Danish children born between the mid-80s and mid-90s, and these data are drawn from the Danish national registers, and they're followed up till 2017. In this 12-year cohort of children, there were a little more than 12,000 individuals fulfilling criteria. At some time in the follow-up period, they were diagnosed with a autism diagnosis from the ICD-10, which means either of the diagnosis of infantile autism, Asperger syndrome, or atypical autism, or PDD-NOS, either of these, and there was at least 12,000 altogether. And we then draw a sample of 41,000, which is the referral sample, or it's the random sample, which is a reference of all of the whole population. And we followed the psychiatric diagnosis was based on diagnosis in the Psychiatric Central Register, and the somatic diagnosis was based on the Danish Patient Register. And we looked at all types of, or the whole spectrum of somatic diseases, which is, as you see here, infectious diseases, neoplasm, or cancer diseases. There's blood and blood-forming organs diseases there, endocrine diseases, diseases of the nervous system, eye, ear, circulatory system, respiratory system, digestive system, skin, musculoskeletal diseases, and genitourinary diseases. So the whole spectrum of somatic diseases was followed in the registers for this group. The results is that we have of the autism spectrum group or sample, there was a little less than 75% of males, and in the reference sample it was split half. There was 50% of each, or 51% of males. And in the follow-up period, which was from 22 to 33 years, we followed up from birth. There was 117 who deceased or died during the follow-up period in the autism group, and there was 521 in the reference group. So there's actually a little more, or the mortality was a little higher in the reference group than in the autism group. And we followed up, as I said, for 22 to 33 years, and we used which calls Cox regression model for the and hazard rates for the statistics. This is very difficult. This is very busy, but it's not just an overview that in all these somatic disease areas, there was an overrepresentation from birth on. There was an overrepresentation of incident cases of all kinds of physical diseases, except from neoplasms or cancer. Everyone else is, there's a higher prevalence or incidence of somatic disease in the ADHD or in the autism group. I'll go to some details, which is easier for you to see also. There was kind of two patterns. If we take the infectious disease and the disease of ear and respiratory system, it's a tendency that it's rather common also in the background population or in the reference sample, but even though it's more common, it's between 50% and 200% more common in the first 5 to 10 years of living that they have accessed the somatic hospital and received a diagnosis of one of these disorders or these categories of disorders. And so this is one kind of pattern. There's another pattern type, which is the nervous diseases and the disease of eyes, where you see another kind of line for it's rather seldom in the background population, but really more common in the ADHD or the autism group. And it's when it comes to nervous system, it's more than it's like 3 times more or more than 3 times more equivalent or incident. You see these nervous system diseases in the autism group. The most significant results, which you can also see some of that within the first 5 years of living, there's a 56% more of the children in the autism group that have an infectious disease nervous system. As I said before, the first 10 years of life, there's 4 times more common that you have a nervous system disease in the autism group. And when it comes to the eye and ear, there's the same kind of profile, but here it's interesting that the female preponderance that you see, there's more females. The difference between the normal or the reference group below and the autism group above, you see that for girls there's even more difference between the two lines or the two patterns. And then we also looked at, for all diseases, we also looked at sex differences. And here's one of the interesting areas, is endocrine diseases, where you see that girls up to the age of 18, there's a 2.5 times elevated risk of endocrine disease, and it's very, very different in females, where you see the race in incidence is a little before boys, and the race is even earlier in girls with autism, and that's probably, I think, because, as we've heard also in this conference, there may be earlier menarche or earlier first menstruation in girls, so they are kind of a little screwed to the left in this curve here. So, what about the strengths of register-based studies is that it's a very rich body of cases. And it allows large samples, and the formation of matched samples is also possible in these nationwide register-based studies. And the data are allowing to get long-term follow-up. There's also, of course, also limitations, concerns about diagnostic validity. Is the autism diagnosis actually valid? And we have tested that in the Danish register, and actually it's quite valid. The validity is a little less when you go to the specific ICD-10 categories of infantile autism, Asperger, and atypical. But when you take the whole spectrum as a whole, it seems that, or it is like the validity of the diagnosis is high. Yeah. There's a limit also that there may be persons or individuals diagnosed with autism outside the hospital system in Denmark, and they are not in the registers, so that is a limitation also. So to conclude, for each of the 13 disease categories, except for neoplasm, the immediate risk of first physical disease within the early years of life was 50% up to more than 400% compared to the autistic individuals, between the autistic individuals and the referral reference individuals. Comprehensive evidence that individuals with autism, especially females from birth to adulthood, carry an increased risk of a large variety of physical diseases, even long before they are identified as autistic in the mental health services. It highlights the importance of an integrated medical supervision and for people diagnosed with autism. Further investigations into the unknown etiology of the association between autism and PDD-NOS, or PDD. Thank you.
Thank you so much. Do we have any questions at this point? Thank you.
Thank you very much for a very interesting study. Have you made it as well with ADHD, and do you see the same development with this group as well?
Yes, we are just looking at the data right now for ADHD. I'm sorry, I turned to say ADHD sometimes, but it was, of course, autism here. But we were looking at the same data, but for ADHD also. But I haven't got any results yet.